A new report sounds the alarm about the coronavirus and mental health. The American Academy of Family Physicians says the risk for suicides is expected to rise in the next 10 years related to the pandemic. It's all due to job loss, isolation, and even social distancing. KQ2's Jody O'Brien spoke with a national mental health expert about how to cope with hidden suffering from the virus.
Numbers out this week show government suicide hotlines are seeing an increase of horrific proportions. Dr. Gregory Jantz, a specialist in the treatment of behavioral disorders and addictions, continues to sound an alarm about this COVID-19 side effect, and he joins us tonight. Doctor, how are you?
Oh, good to be with you. This is such an important topic, and I'm glad we can talk about it because we know, and we're preparing here at the Center of Place of Hope, we're preparing right now for higher numbers of people who are in despair, who are at a place where they are seeking help for suicidal thoughts and what we call suicidal ideation.
So tell us why COVID? Why is COVID the thing that's putting a spotlight on this condition in our country? We already knew that we were in a mental health crisis, but what are you seeing as far as a change goes?
Well, one of the things we know is about 61% of folks already, before this all started, before this pandemic started, we're finding 61% said they're already lonely. So we've already got loneliness. And then we've added on top of that chronic stress. And here's the form. Chronic stress is through isolation. Chronic stress is now through financial stressors. People who have had post-traumatic stress disorder, all their symptoms, they've been re-traumatized. People with obsessive compulsive disorders, you know, you can't get enough of this and you can't get yourself clean enough. And so we have a lot of self-doubt. Is it safe to go out? It's not safe to stay inside anymore. I'm going crazy. So we're having people, all these issues are being amplified. And the World Health Organization tells us that depression is the #1 disability in the world. They're calling it a disability. So, but now here's what's happening. Anxiety is being called the new depression. The new depression, anxiety. So we have a mix of anxiety, depression, we have isolation. It's kind of a ticking time bomb. And then people are moving over and they're feeling more despair. They're in despair. And so this is where the irrational thinking starts to happen. And I start to think things like, well, I can't make it. It would be better off if I wasn't here. So that's the place that we're seeing people.
I know we talked earlier that the government hotlines are seeing a 1,000% increase, and that's almost hard to believe. 1,000% more calls to suicide hotlines. What can we do as neighbors, friends, relatives to help those that we know are struggling, and even those who maybe we don't know for sure, but we suspect are struggling?
Well, I want to share a personal example of what we're doing as a family. My wife put a notification on all of our devices, you know, those notifications. And it says, and I'm looking at it right now, it says 1 person a day. And it's a reminder. She says there'll be 1 person a day that all of us will come in contact with that either needs a good word or they need something to eat. But there'll be a person a day. And so I'm encouraging folks, just look to your neighborhood, look around and go, who's my 1 person today that maybe needs a good word or needs me to check in on them? I think we've got to be looking out for one another. And it's not about looking out for one another in a negative way. Like, is that person doing something they shouldn't be doing? Come on, we don't need to be doing that. We need to be looking at, how can I help somebody today? Because there are people in our neighborhoods that really could use us reaching out to them, just meeting some basic human needs right now.
You know, May Day was a good day because we had flowers on our doors from neighbors. And as much as some of us huggers wish that we could be hugging our neighbors and our friends and consoling, there are those meaningful ways that we can touch other people without the human touch. So I thank you for helping us to remember that. And I know that you've written a book on depression, and I didn't know if you could tell us the name of that and where we could find it if we wanted to look you up as an author.
Yes, Healing Depression for Life. I just happen to have it right here. Healing Depression for Life. And really what we're seeing is this is an opportunity for all of us to reset and we may be struggling with depression, or maybe it's been an issue. And really, if the World Health Organization says it's the #1 disability, that's a lot of us. And we should not have shame about asking for help. This is a time to reset. This is a time to look at, okay, how can I get help? And sometimes help comes from a good book. Other times help needs to come from asking for help and allowing for professional intervention.
And last question, just if you are struggling today, what is the best first step to take? If you realize you're struggling, you know you're down, you know that the situation that you've encountered with COVID has impacted your life, and you're just feeling just depressed, down, maybe even having those thoughts, what's the first thing that we can do?
Well, those thoughts always will amplify in isolation. So if I'm holding those inside and I'm just being self-absorbed with those thoughts, they'll tend to increase. So I think the first thing to do is being honest with yourself. And then it's okay. We've mentioned hotlines. It is time to reach out. It's time to tell the truth about how you're feeling. And if you're feeling that despair, speak about that, because that's where we start to get that zone of kind of irrational thinking. And we need to be willing at this time to ask for help. People don't regret asking for help. They usually regret not asking for help.
Absolutely. So that hotline number is on your screen right now. If you do need help, please do call that hotline. All right, Dr. Jantz, we thank you for joining us today, and thanks for all that you're doing amidst this pandemic.
We need each other, and you're welcome.
Thank you. All right, we're going to take a quick break, and we'll be right back.